Good afternoon, everybody. I just want to do a quick little how-to. I've been sending out a lot of health tips of the day. I've sent out a lot of information on hand washing, mask wearing, but as of Sunday at 8 p.m. in Pennsylvania, and I believe it's the same time for Connecticut, everybody who leaves their house essentially will be required to have some sort of a mask on. So I just want to go over the usage of masks, the proper way to use them, what the recommendations are. Recommendations are changing continuously, and people are going to have to wear them to go to the grocery store, any outing, and anybody who is working in any industry, not just in healthcare, will also have to wear masks. So this is a common mask right here. And I'll go over first the usage of this one. It is very important to label your mask because we are recommending that in retreats to utilize and reuse masks, hopefully for a week. In general, this has not always been the case, but we have not been in the situation of a pandemic before. So our attempt is to try to use one mask for a week, and you would replace it at the end of the week, or you would also replace it if it becomes wet or soiled at all. What is most important is you should always utilize your mask with the ear loops. That's how you should pick it up, hold it, and do everything that you're doing with it. You should put it over your face, over your ears. You want to stretch it out completely. There is a wire part in almost all masks. You want to form the wire over your nose the best that you can. The goal is to cover all the way over as much as you can under your chin, all the way up to your nose. Some of the things that you definitely should not do with wearing masks. You should not touch the front of the mask. If you do touch the front, then you should take your hands, wash it with an alcohol-based hand sanitizer, or wash with soap and water. The other things you should not do with a mask. You should not just cover your mouth with the mask. You must have your nose and your mouth covered. You also should not pull down this way in order to talk to somebody with your mask. So remember, have it on over your nose, tighten the wire over your nose, cover all the way under your chin. A mask that is loose is not doing as much as a mask that is fitting well. It is important to always on and off through the loops. That's how you should utilize it. If you are reusing it, I take it from the loop, I bend it, and then I store it in a paper bag. Not everybody has this little of a paper bag. I like that it's little because it decreases the chances of me moving the mask around or getting the face part where there could be germs and bacteria attached to touching anything. You want to make sure that your bag is labeled. I keep this in my vehicle, so I have it at all times. So if I'm going into a store, going anywhere, even though I haven't gone many places, I have it in the car with me at all times. So when you go to use it the next time, you pull it by the loops. The first thing you're going to do, I'll start with, you should wash your hands either with your antibacterial hand sanitizer or soap and water. You pull it from the loops. You always have the color side out. Now, some of them are colored yellow, green, blue. They usually have different colors. The white side's the side going to your face. The color side is out. Put it on, stretch it out, and you're good. And then taking off, we already went through. It is recommended that you do not have facial hair because facial hair will make it loose. Many of the homemade masks have an insert on top, and there's a wire put in it to create that wire section for your nose so you know which side is up and which side is down. The other thing that these homemade masks have is an insert for a paper mask. So if you took a paper mask and you put it in with the blue side facing out, this is a way to give even more protection for you when you're using your mask. So once you get that in there and you have your wire in there, once again, you use your loops. I have mine labeled on my loop because that was the easiest place for me to put it. But you put it on your face, around your ears, spread it out, form it to your nose, and you have a double layer of protection. when you take it off, same way. This one's a little bit easier, I think, to fold, and then you put it into your paper bag. I have been washing this every day after I use it. I wash the outer layer part just because I can. But that's pretty much the long and short. After you take it off, you should also wash your hands with soap and water or use antibacterial as well. You don't want to store these in plastic bags. Many viruses and germs live longer in a plastic bag versus paper, but if that's all you have, it's fine. It's just paper would definitely be better. And the other thing is, so besides not touching the front of it when it's on your face, not moving it to below your nose or moving it below your mouth so that you can talk, it should be as form-fitting as possible. You don't want it to be too loose. And you want to make sure that after you take it off, you don't just leave it on a desk or leave it somewhere without some protection. So making sure you have some sort of bag to store it in really does make sense. What I've been seeing in a lot of places, because when you have so much of your face covered, especially in healthcare and you're trying to connect and speak with patients, a lot of hospitals are putting a picture of themselves on their jacket or their shirt. So even though they can't see your whole face, they can see what you look like. At Retreat, we have our name badges, so it's really important to have your picture badge. I mean, has your first name, last initial, and your picture on it so they can see who they're really talking to. So it is important always to have this on when you're working with patients. If anybody has any questions, let me know. I hope that that may answer some questions on how to use masks properly during COVID-19.